Welcome, everybody. It's a pleasure to join you as we examine the impacts of legalized recreational marijuana here in the state of Colorado. I'm Kim Fino with the Department of Excise and Licenses here in the City and County of Denver. Please join me in welcoming our panel, Jack Reed, Caitlin Hall, and Julia Dilley. Take a look at our presentation roadmap. We'll be going through the national marijuana policy landscape and then quickly looking at environmental, economic, and operational impacts here in the City and County of Denver and the state of Colorado, followed by the Department of Public Health data from a multi-state perspective and Colorado public safety data, followed by your questions. And with that, we will get going. We'll take a look at our legalization map. This map will likely change in the next couple of days as there are a few states with initiatives under consideration. Adult use is under consideration in Michigan and North Dakota, and medical use is under consideration in Utah and Missouri. CBD is legalized in 17 states, which you can see here in yellow. Adult use and medical use is available in 10 states, which is shown in blue, and medical marijuana legalization is shown in orange, which is available in 23 states. There are only 2 states with no policies whatsoever, and those are shown in gray, Idaho and Nebraska. All right, so we'll shift over to local administration, and starting with environmental impacts, we'll be looking at how green the industry really is. To start us off, we'll take a look at the energy usage by marijuana businesses. Currently today, marijuana businesses are taking less energy to produce a grown pound of marijuana than they were in 2014, which is great, more efficiency. For the most recent period, 2016 into 2017, average electricity use by marijuana businesses grew 10%. This represents a decline in the rate of consumption by marijuana businesses. It's the lowest rate since 2013 to 2014. And that accounts for 4% of energy usage in total of Denver's total energy usage. Moving on to water usage. Denver Water has identified 228 industrial grow house sites, and these sites have used up 400 acre-feet of water in the year 2017. That equates to 0.25% of all usage, and that equates to about roughly what the brewery industry uses. It can be difficult to get exact measurements for both of those industries, as outside of these identified sites, many are located in co-located properties, which can be difficult to tease the information out of. All right, moving on to wastewater. One obvious environmental concern is whether or not the industry is adding contamination to the water supply. Denver Wastewater has examined that and is finding little to no contamination occurring, which is wonderful news. Moving on to recycling. For recycling, we worked with Alpine Waste and Recycling. They're the only recycler that's working directly with the marijuana industry right now. Of their consumer base, their average customer uses about 12% waste diversion to recycling, and marijuana customers are actually diverting 18% of their waste through recycling programs. So they are greener, and that is good news. Okay, moving on to health. Local health assessment was performed in 2014. This was focused on several of Denver's most industrialized neighborhoods, and it was found that odor was a leading quality of life complaint, causing eye, throat irritation, nausea, headaches, and causing citizens to be reluctant to exercise, garden, be outside in general. 90% of respondents said their lives would be improved if odors were reduced. Marijuana was the 4th leading cause of odor concerns behind shingle manufacturers, pet food manufacturers, and industrial waste. Denver, in response to that, adopted an odor control ordinance, which requires all of those industries to obtain and use odor mitigation technologies, and that has reduced odor complaints by 44%. Okay, we'll take a look at our economic impacts of recreational marijuana legalization. Start out with our marijuana sales. This takes a look at both at both medical and retail, which is the blue line there is our medical sales, and the green line is our retail sales. What we can't totally see here, this is calling out the month of July for each year, starting all the way over there in 2014, 2015, 2016, and ending up in 2017, July for each of those years. These are shown in the millions of dollars. Retail marijuana quickly outstripped medical marijuana sales at the conclusion of our second year. So that has been growing strongly. Medical marijuana sales have declined comparatively, and their decline has gone from accounting for 55% of total gross marijuana sales. Now they make up only 35%. There are a lot of speculation about why that might be continuing so highly. And one of those is that locally, some jurisdictions only allow medical marijuana sales to medical marijuana customers, while it's also taxed at a substantially lower rate. Okay, now moving on to Colorado as a portion of the Colorado GDP. Is it bringing a lot of money into our state economy? I would say not exactly. As $1.5 billion in marijuana sales in 2017, which is a huge number, but it only accounts for less than 0.5% of the total Colorado GDP for that year, which was $343 billion. It's so small, I actually had to force it to appear on this map. It did not appear organically. All right. This takes a look at Denver's marijuana revenues compared to expenses. Shown in blue are the revenues realized from marijuana sales in the city. Shown in purple are our allocated priorities for regulation, enforcement, education, and public health. The excess that is not allocated to those expenditures goes to the city's general fund, and the city's general fund will then take care of things like sidewalk repairs, rec center creation, and affordable housing. It also takes care of any indirect costs associated with legalization. Okay, like that skipped one. Okay, if we switch over to taking a look at the tourism impact, this is a difficult measure. There are a lot of studies being conducted around whether or not marijuana has a negative impact on local tourism. This study was performed by Longswood International, and it, along with those other studies, shows the same picture, which is that people generally do not care that marijuana is legalized, and for those that do care, it tends to encourage them to come and spend their dollars here with us. Okay, another great question we want answers to is how much industry jobs are being created. And for that, we turn to the Marijuana Policy Group, a research outfit that specializes in analyzing the economic impacts of the industry. They've analyzed a mix of state key badge data, industry survey data, and just general economic information to arrive at this estimate, which has us just below 10,000 directly created jobs and additional 4,000 jobs indirectly created. Okay, we'll move on from the economy. We'll take a look at the day-to-day operational aspect of regulating here in the city and county of Denver. This takes a look at our local business licenses by type. This slide is a little out of date. We currently have 1,116 active marijuana business licenses, and those break out into the categories you have here. We have retail and medical variations for grows, for stores where sales are performed, for medical infused products, which are edibles, testing facilities, and marijuana transporters. That's 36% of the state's total marijuana licenses, and we are home to 13% of the state's population. Okay, so this takes a look at Denver's business licenses over time, the volume per period, and also by location. We currently, according to this graphic, have 1,122 locations, again, a little out of date, and that is been pretty slow and steady thanks to the caps and moratoriums that Denver has put in place to maintain slow, steady growth over these businesses. Additionally, for locations, primarily slow and steady growth, and we are only about 21 locations higher than we were during January 2014 when retail marijuana was originally brought online. Okay, this takes a look at marijuana licensing applications. I want to call your attention to the red segment. This is our renewal population. This is showing us that almost 100% of the licenses are renewed annually because they are very valuable licenses. And you can also see in the proportional populations of our new applications, transfers of ownership and corporate structure changes, which are green, yellow, and blue segments. Those each equate to 9 to 10% of the volume of transactions we process in the city and county of Denver between July 2014 and August 2018. So those are showing a high volume of trade between those. Okay, with each new transferred or modified license in the city and county, 6 different industries, agencies, go through and inspect the properties to make sure that they are, operating at full regulations. One thing we know that they are very time consuming. Obviously we're going for a very quality inspection. And they can range anywhere from 50 minutes to 2.5 hours on average. So they're quite time consuming. It'll take us 8.75 hours for the entire business to be reviewed. This only takes into account our initial inspections. So we are really looking at a much larger base of inspections being performed. Okay, which kind of brings us over to staffing, because obviously it will take increased staffing across a number of departments to facilitate taking care of regulation of marijuana. It's a big ask for any group. So for Denver, they focused on providing support to the industry and adequate resources for all citizens here in the city. We've expanded 58 full-time employee positions across these departments for 2018. Okay, another positive that we see is that compliance improves over time. This slide gives us a look at the average number of public health inspections. These are food industry inspections performed on marijuana businesses. And we show an increased rate of compliance over time as we invest more time and energy in educating the industry. All right, one last quick look. This assesses marijuana crime as a % of total Denver crime, and it tells us a very positive picture. That crime has maintained fairly steady from the time of legalization and post-legalization, still maintaining at below 2%. All right. That was a look at the city and county of Denver. Next up, Caitlin Hall and Julia Dilley to talk about public health data.
Good afternoon. I'm Caitlin Hall. I work here at the State Health Department as a marijuana epidemiologist. And I'm going to be talking today about what has happened to the state public health after retail legalization in our state and the 4 other first states that legalize. And we think that it's really good to know the public health impacts of marijuana legalization before you legalize. So our objective today is to just provide some data highlights from the 4 states that first legalized recreational marijuana, and that was Alaska, Colorado, Oregon, and Washington. We're going to review youth cannabis use, adult cannabis use, some calls to the Poison Center, hospital and emergency department discharges, and some market data. So this first slide is just to show you how complicated this work is. Here we have 2 surveys that are surveying the same population in Washington. We're looking at high school students in Washington from 8th through 12th grade. And the blue line is one survey and the gray line is another survey, and each point represents the same time period. And as you can see for each grade here, there are very different trends happening in both of the surveys. And the point in showing you this is that it's difficult to measure these indicators, and also it could be that it's a little bit too soon to know what's happening with some of our populations, particularly youth. But with that being said, we still need to monitor our youth populations and our adult use, or use in our adult populations. So we do have surveys in all 4 states that monitor high school past 30-day marijuana use. And these are usually given in schools where students will self-report using marijuana at least once in the past 30 days. And here in the colored lines, we're showing all 4 of the legal states, comparing to the US national average in the dark line. And we're going back to 2010 all the way to school year 2017. And the vertical lines here are indicating different legalization time periods for these 4 states. And basically, we've seen youth use is pretty flat and or maybe following the US trends of declining over time. But it's also important to look at trends in different populations, particularly by gender and age groups. Oops. Sorry, this is an outdated version, so I will bear with me here. When we break down these past 30-day use groups by gender and by age, we see different patterns. So here we're looking at high school boys in 8th through 9th grade, and we can see that the past 30-day use is decreasing over time, and particularly post-legalization in all states and possibly US. When we look at younger girls in the 8th and 9th grade, we see a pretty stable trend in past 30-day use. And then when we look at older boys, this is 11th and 12th grade, past 30-day use, we also see a stable trend. However, when we looked at older girls in 11th and 12th grade, and it's a little bit difficult to see in this slide because of all the different lines, but we start to see some increasing trends, particularly in Alaska, in the yellow line here, and possibly in Colorado, the orange line. And then if you can see in the blue and gray are increasing as well. And here we just took all those 4 slides and put them together so you can see the differences on one slide. But across the top we have the younger age categories for 8th through 10th grade, and then across the bottom is the older age categories from 11th to 12th grade. And the girls are on the left-hand side and the boys are on the right-hand side. And in the outlined red box, you can see that the older high school girls are having a different pattern in their use trends over time compared to the other categories. All 4 states are also looking at adult past 30-day marijuana use, and this is captured in a similar way as it is with high school students, except that these are telephone surveys, so you have to answer the phone, take the survey, and then you self-report using marijuana at least once in the past 30 days. And here, all of the colored lines at the top are our legal states, Alaska, Oregon, Washington, and Colorado, compared to the national US estimate in the dark blue line. And all 4 of the legal states are above the US estimate for past 30-day marijuana use. And just in 2017, and the Alaska time point is missing here, but all 4 states showed an increase in past 30-day marijuana use among adults. And that was the first time that all states have showed that increase. We also measure poison center calls with marijuana exposures in 3 of the states. Alaska measures this as well, but their numbers are very small, so it's hard to get good estimates. Here we're showing the rate of marijuana exposures that are reported to the poison center for Oregon in the dark blue, Washington in the light blue, and Colorado in the green. And the vertical bars here are just indicating when the legal markets opened. The bar in 2014 is indicating Colorado and Washington legal markets opening. And if you notice, the light blue and green lines showed an increase in poison center calls with marijuana exposures at that time. After the markets opened, Washington and Colorado are seeing a leveling in these poison center calls. And then Oregon markets opened in 2015. Oregon also experienced an increase in call volume with marijuana exposures. And they might be experiencing a decrease or a leveling, but it's a little bit too soon to tell at this point. Here we're looking at the exact same figure, but instead of rates, we're looking at numbers. And on the left-hand side, we're showing the number of marijuana exposures reported to the Poison Center for the 3 states out of all age groups. And on the right-hand side, we're showing the number of reported marijuana exposures in children under 9 and in under 6 in Oregon. And as you can see, there's a much different pattern here. In the children under 9 and 6, we're seeing increases continuing even in post-legalization markets up until 2017. And this is concerning and something that we are continuing to monitor and feed this information into preventative services for education on parents on how to store marijuana safely. Colorado and Oregon looks at hospitalization and emergency discharges for potential adverse health effects that are due to marijuana or related to marijuana. And in Colorado, here we're showing the rate of hospitalizations in blue that have at least one marijuana discharge coding listed, and then we're showing the rate of ED visits in green that have at least one marijuana code listed. And for our hospitalizations, we've seen across each legalized time point here, indicated by the vertical bars, we have seen an increase in hospitalizations indicating marijuana use. And then in our ED visits, we saw increases leading up until the markets opening in 2014. And then post-markets opening, we might be seeing a leveling of ED visits indicating marijuana, or we could be seeing an increase. We're not quite sure yet. The gray dots here are preliminary data, and so we're waiting for those to play out for our ED visits. Colorado also monitors the primary diagnosis of these discharges for hospitalizations and ED visits that have a marijuana code listed. And what we found in Colorado is that among ED discharges with at least one marijuana code, we saw a 5-fold increase prevalence of mental illness primary diagnosis compared to ED visits without marijuana coding. And this trend was reflected in our hospitalization discharges, where we saw a 9-fold increase in mental illness primary diagnosis among those with marijuana coding compared to those without. Here I'm showing similar data in Oregon, where the bottom line are the poison center calls indicating marijuana exposures. The middle line here are ED visits with marijuana discharge coding, and the top line is hospitalizations with marijuana discharge coding. And much like Colorado, Oregon experienced increases up until the markets were opened, and then post-markets opening, Oregon may be seeing a flattening of these increases or maybe even a decrease. It's still a little bit too soon to tell what's going on here. And now I'm going to turn it over to Julia, who's going to talk about the market.
So Caitlin just talked about some of the trends and differences between states and some of the public health outcomes that we've been monitoring since legalization. And now I'm going to talk a little bit about the market environments that within which all these public health outcomes are occurring. So first, to start out, these are the four first legalized states, and this is the number of cannabis retail outlets that are operating in each of those states. So Alaska, most recently, when we updated it this last month, had 71. Oregon had 591. And then the bars on the right, the blue bars on the right, are the per capita number of retail stores. So, when you just look at the number of retail outlets, they look different, but what's, I think, more interesting is when you contrast that with the number of people within the state. And then you can see Alaska and Colorado actually look pretty similar in terms of the number of retailers operating in the state. Oregon is outpacing the other four states in terms of retail per capita, and Washington has fewer. And Washington is the one state among the four that's got a statewide cap established for the number of retail outlets that are allowed, and then the number that are actually selling are fewer than what's totally allowed, because there are a number of cities and counties that have acted to ban retail licensing for now. So again, thinking about the market environment, so the first thing I'd like to think about a little bit is price. And price is important from a public health perspective because we know that people are price sensitive when it comes to substance use. So we know with tobacco and alcohol that as price varies, people's consumption patterns will vary as well. So this is, I like to use billboards just to kind of illustrate the messaging and the what people are seeing out in their communities. This is from Tumwater, Washington, a couple of years ago, and that is back when $10 a gram was still billboard-worthy price point to talk about. And then here's a couple of years later. This is Portland, Oregon, which borders the Washington market. So this billboard is more recent. This is after both Oregon and Washington markets are open. It's after some of those efficiencies. Kim talked about how the businesses are able to be more efficient now than initially. So maybe the price drop is reflecting in part increased efficiency of operation. And then this was just again in Portland from just a couple of months ago, and I had to do the math, and now we're getting down to $1.41 a gram if you buy in this quantity from this outlet. I'm assuming this is not the top shelf stuff, but it is just interesting to me how, you know, the price points that we're seeing out on public marketing have changed quite a lot since opening of the market. And in fact, we see the same story told when we look at the market data. So this is data from the Washington State seed to sale market. So we have records of all the different sales and transactions of cannabis throughout the state. And we've been analyzing that as part of a research grant that we have. And what you're looking here is the tax-inclusive price per gram over time from when the market first opened. The solid line is the average, and then the dotted lines are the margin of error around that. So you can see that in the beginning we started with a fairly expensive price per gram, and then it's dropped quite a bit. And this only goes through September of 2016. More recent data suggests that it may be continuing to become more, or less costly, I should say, over time. And I don't know why Washington would be any different than the other states, but we do need to be starting to look at this in other states as well. So that was price. Now let's also think about products and potency that are out there. So what is the dose that people are getting when they're using? Again, billboards, I think, tell a story about what the kinds of conversations and choices people are making when they're visiting the market. So some of the billboards we've seen out there appear to be reflecting maybe consumer interest in high potency products or maybe high consumption of products, so aim higher. This is from Tacoma, Washington, about a year ago. This was the billboard that sort of tipped the legislature there to take some action, and they actually changed the allowable advertising out in the state in part because of conversations and complaints that came up associated with this billboard. This is from Portland, Oregon. Again, a billboard I never thought I would see on a major highway within the state. And last, a billboard, advertising high-potency concentrate products, so not even just usable flour, but high concentrates, which I think previous to the market opening, we considered to be rather rare, but now perhaps more common. And again, this is an analysis from the Washington State seed to sale system. So it tells, again, the same story that there is increasing interest in cannabis products overall, but specifically among high concentrate products. So what you're looking at here is the quarterly sales by product type. So overall sales have been increasing over time. That's not a surprise. But also the amount and the proportion of total sales that are the high concentrate products are increasing. And so thinking back to the public health data that Caitlin was talking about, what's worrisome is the public health data we're monitoring, all the evidence that we have about any health effects that are associated with marijuana use or cannabis use, all of our research is pretty much based on old data about exposure. And now what's happening is the market, the availability of products out there is changing, becoming more potent, becoming cheaper, becoming more widely available. So I think it really is too soon to tell what the effects of legalization will be on public health outcomes. Potentially a more positive implication, I mean, this is very speculative, but I think it's possible that some good things can happen as a result of legalization. So here what you're looking at is the percent of youth who say they perceive great risk from regular marijuana use. This is collected again from the school-based student surveys in the 4 first states. On a national level, we've been seeing this decline. So over time, for quite a while, there's been a pretty steady decline in perceived harm that youth feel from regular marijuana use. But in the legalized states, we're actually seeing maybe a different change in direction. So in Colorado most recently, in Alaska as well, and somewhat perhaps in Washington, some increases or at least a stable trend in how risky youth think regular cannabis use may be, and maybe that's associated with some of the prevention campaigns that have occurred in the context of legalization or following legalization. So I think this may be a good outcome indicator that we can be tracking. So last, you've been looking at pictures of billboards, and now let's talk about, for a second, the actual influence of advertising. So I'm particularly interested in what young people are seeing around advertising. This is a billboard from Thurston County, Washington. This is a billboard, incidentally, that does pass the new restrictions for advertising in Washington State. So it's not just cannabis advertising directly, but also some of the peripheral industry advertising that may be being seen by people in our communities and may be influencing norms and attitudes about cannabis use. So here, this is from Oregon, where home grows are allowed. This is not a cannabis industry billboard, but rather a hydroponic industry billboard that is referencing the fact that you can use their stuff to grow your four plants. And then there's all kinds of other little side things. So this is a picture of an ad for home delivery cannabis, which is allowed now in Portland, Oregon. We don't have that in Washington State. So in terms of, in total, how much advertising are people seeing? In Oregon, we've had 2 data collection efforts to assess that in our state. So we first used one of our established public health surveys to ask adults in Oregon in 2015 and 16 how much, if they had seen or heard advertising for marijuana products or stores in their community in the last 30 days. And over half of adults statewide said that they had. About a year later, we were able to add a similar question onto our school-based youth surveys, and 72% of 8th graders said that they had seen or heard a cannabis ad in their community in the last 30 days. For both adults and youth, we split that up by whether a person lived in a community where retailers had opened. We did that 2 ways, actually. First, by assigning a person to a community and then looking at whether there were any licensed retailers in their community. And then for the adult survey, we also just asked people, is there a retailer in your community? And the results are the same and not surprising, which is that people who live in communities where a cannabis retailer is operating are more likely to have seen advertising than people who live in communities without retail operations. So Caitlin and I have just presented to you some snippets, but we're working all the time on generating more information from the early adopter states, and I just want to encourage you to check out some of the reports that the 4 early adopter states have posted on their websites, and there's the links to them. And I thank you, and I'm going to turn it over to Jack.
Everybody. So I'm Jack Reed with the Colorado Department of Public Safety. I'm going to be reviewing some crime data, a little bit of impaired driving data, and some of the impacts in our schools. So people have talked about some of the recent changes to Colorado's legal landscape. Gray and black market grows were becoming increasingly problematic. Our legislature has passed a few laws to try to deal with that. The first one establishing a 12-plant limit in a home. The second established about a $6 million grant program to reimburse local law enforcement and district attorneys for black market marijuana enforcement. It also created a unit within our Colorado Bureau of Investigation that will actually go out and assist agencies, particularly in rural areas where they may not have the resources to engage in some of the complex investigations that a high-level illegal marijuana grow can cause. If I'm giving you a ticket for marijuana possession, that's pretty quick and easy. If you are growing hundreds of plants and putting them on a plane and flying it to Minnesota, that's a much more complicated investigation. And I think one of the things that we've encountered in Colorado that we really are trying to work on from an enforcement point of view is giving tools to law enforcement so that there are brighter lines and so they have more resources to deal with some of these issues. We also put in some new edible product rules. There's that marking for THC that's required on the products. And they can't look like fruit, people, animals, or candy. I've also been told this applies to mythical creatures, so it can't look like a Pegasus or a unicorn. So one thing we have talked about and that Julia talked about are just kind of the variety of cannabis that we're seeing in the marketplace. This matters from a public health point of view. It also matters from a public safety point of view. And I'll get to that and why that matters in a little bit. So, we've got our standard flower and vaping And this hits you immediately. We have our concentrates, which are a much higher percentage of THC in them. So cannabis flower, you end up with 10 to 25% THC. With concentrates, there's concentrates available that have up to potentially 90% THC. You use them in a different way. It often involves a blowtorch. Really, I'm not joking. And then edibles. Edibles have a completely different effect on your body when it comes to both how long it takes to get through your digestive system, and from when we're talking about something like impaired driving, how it goes into your bloodstream is a much kind of like, it's slower and it lasts for longer. And we'll talk about why that can matter. And then we also have different alternative use products. And as far as I know, there's really been no research on inhalers or eye drops, and how those actually have, the eye drops were, I think, new for a lot of people. And I'm not sure exactly, I think it's for glaucoma, but the specifics of how it's actually, affecting your body, we just really, really have no good information on, from either a public health point of view or a public safety point of view. Okay, so just kind of marijuana arrests in Colorado. So this is 2012 through 2017. 2012, the year before legalization, 2013, basically the number of arrests gets cut in half. Primarily, that decrease was marijuana possession arrests for adults over the age of 21, for whom marijuana possession of an ounce or less is now legal. When you look at it by age group, that top group is, this is the rate of marijuana arrests per 100,000 in that age group. So that 18 to 20 group, we did see their rate come down. They still had the highest, they still have definitely the highest rate of about 900 per 100,000 youth picking up a marijuana arrest in 2017. The juvenile rate, that 10 to 17 rate though, hasn't changed substantially over the last 5 years. It's come down very, very gradually, but we haven't seen any major drops in the number of juveniles who are picking up marijuana arrests because it's still illegal for them. They're picking up possession arrests. They're not engaged in any of the higher level marijuana crimes, but they are still picking up possession arrests. And then that bottom line is adults. So the fact that their rates are about 1/5 what they were prior to legalization indicates that that drop in possession arrests, again, possession that is now legal. One thing that I know is concerning is the social equity aspect of this, that minority neighborhoods especially have seen disproportionate impacts of marijuana enforcement in their areas. Colorado has, we're really not different than the rest of the nation, unfortunately. The rate for arrests for marijuana for African Americans is double that of whites or Hispanics. It's come down, and it's come down across the board amongst all races. The nature of the disparity, though, is still there. The arrest rate for African Americans is about double that of whites. There's another, let's see. Okay, yep. And there's also different types of arrests that you can get. You can get a ticket where they tell you to come to court. That's that top line. About 3/4 of people who get arrested don't actually get put in handcuffs and taken to jail, right? They're given a ticket and they're told to come to court. There are still legal consequences for it. It still goes on your record. It can still be a conviction. About 22% are the ones who actually get cuffed up and taken to jail. And about another 6% have a warrant out for their arrest. They already did something bad. They didn't show up to court probably, and now they have a warrant for their arrest. One thing that's not on this is when we're looking at that disparity, the racial disparity again, when you look at that number of people who are getting a citation, whites get a citation 3/4 of the time. So about 75 to 77% of the time, whites are getting a citation. So here's the ticket, appear in court. Hispanics, about 66% of the time, they're getting a citation. African Americans, 55% of the time, they're getting a citation. So 45% of the time, they're actually, being taken to jail. That difference, this is new data for me. I didn't have this until a few months ago. And I think that, when we're looking at things like disparity, not just the fact that an arrest is occurring, but what kind of arrest is occurring also has an impact. Because I don't know if this is more about bond and stuff, but if you spend more than 3 days in jail, there are serious long tail impacts to your life. And so, there's the disparities that occur by race are interesting. So this is case filings. So the actual, you get arrested, a case is filed. This is data for 2008 through 2017. Yeah. What we see again is, 2013, a major drop-off. That yellow line, the biggest orange, I guess, orange line are petty offenses. So those are really minor possession arrests. We see those drop off. We actually see everything really drop down in 2013 and 2014, in part because there were very, very few clear guidelines for law enforcement and for district attorneys about what could be prosecuted, how was it going to be prosecuted, and if a person took this to trial, would a jury convict? And so we see this drop. And then we're gradually seeing an increase in especially higher level offenses. So this is a look at more serious drug crime types. One thing I think if you've talked to law enforcement here, that they will discuss, an issue that we have in Colorado is that the black market hasn't gone away, but the black market has changed some. In part because our marijuana enforcement division, what they found through their market study was that the demand for cannabis locally in Colorado is being met by our legal market. However, there's a demand for cannabis outside of Colorado as well, and that what we may be seeing is a black market that is now intended to fill demand outside of Colorado. So these are more serious crime types. So what we're seeing since 2014 is an increase in possession with intent to distribute, manufacturing, conspiracy, distribution, and manufacturing. And so these are all, again, more serious types of crime that are more indicative of black market activity. One thing that's important to remember, though, is, prior to 2013 or 2014 when sales began, everything was black market activity, right? And so there was this kind of, shift downward and now a shift back up. I think is not necessarily unexpected. And it will be interesting to see moving forward, especially as more states come on board with legalization, what happens to this kind of illicit grow activity. So growth on public land is something that people have an interest in. It was one of the factors in the Cole memo that was issued by the Department of Justice that said these are these 8 things are really important. One of them was growth on public lands. You can see that in the southern part of Colorado, we've got a lot of land that's National Forest Service, that's Bureau of Land Management, and over the last 3 years, in 2014 there were about 4,500 plants that were seized on public lands in Colorado. Last year there were over 80,000 plants seized on public lands in Colorado. And the number of seizures also went up. Actually, there was one 8,000 plant. It was in the middle of an island on the Colorado River. It was really cool. Interesting. How about interesting? It was actually really interesting. One other thing is, we do collect some information on marijuana that gets seized after it has left Colorado. It's a voluntary reporting program through the El Paso Intelligence Center. And what we see here is that where the marijuana is seized is the states that are closest to us. We do have some information about the marijuana, where the marijuana is the destination for the marijuana. Where it's being seized is not the destination. It's just where it's actually being seized. So Kansas, Nebraska, and Wyoming seized the majority of marijuana that's coming out of Colorado. Oh, this is also old. So one other thing that has changed as well, and this is kind of something that Julia mentioned, is the changing nature of the market. So in 2013, about 86% of the marijuana that was seized was bud or flower, right? And about 6% was concentrates and about 1% was edibles. That has now changed dramatically as the market has changed. About 60% now is bud and flower, 26% is concentrates, and 16% is edibles. And when you look at those concentrates and edibles, I think that when we're looking at diversion from our legal market, that the concentrates and edibles are more, there's the likelihood of those being diverted from the legal market are definitely greater at this point in time. One other thing that people have wondered about is, so what effect is this having on your overall crime rates? So the blue line is Colorado, the green line is the nation. What we have seen is that our crime rates, our violent crime rates anyway, are increasing slightly. That increase effectively mirrors that of the nation, and our violent crime rates are still below the national average. Property crime tells a slightly different story, where our rates are a little bit higher than the national average. Ours have kind of been flat, while the national average has gone down. So we haven't seen a major spike in violent crime or a major spike in property crime after legalization. One of the questions I get most is what's happening with impaired driving. Our Colorado Department of Transportation has actually done some really, really good work on public campaigns to try to decrease impaired driving. It started with kind of a funny one. In this particular case, this person, the tagline is, you can now grill while high, you just can't go get propane when you ran out. They moved on to a kind of a more serious message, looking at hits lead to hits, and showing some of the the consequences of driving high. What it can look like when you crash a car, and these are a couple of the things that they put out. The one was actually, I think, not too far from here. The one that's on that side of the building, and they also do partner with ride sharing and the industry to try to really get the message out to consumers that driving while high is dangerous. The National Highway Traffic Safety Administration just came out with a new campaign called "If you feel different, you drive different," and to really try to get it out to people that when you're consuming cannabis and it's affecting you, it's affecting how you feel, then that is going to affect how you drive. And the bottom one is the 320 campaign, which is basically kind of a plan before you use. 320 being so they rolled this out in March. In advance of 420 in April, to try to get people to think about not driving while high for at least a month prior. So this is this is data on the last day of the last session. It can be so challenging. So I really do, just kind of step back, I really want to thank you all for staying for for this. I really do want to thank you for that. Okay, back to this. So this is a graph, and this actually really also kind of gets to Julia's point about where our research is versus where our current products are. So this is a graph of THC in your body, right, over time. And this is smoking, and it's probably smoking with stuff that you would get from the University of Mississippi, which is the only place where you can get cannabis to do research with. And what happens is you get that initial spike when you smoke, right? It goes up very, very quickly within the first 10 minutes. It comes down very, very quickly. That black dotted line is the level of Delta-9 THC in your system that creates a permissible inference of impairment in Colorado. It's 5 nanograms per milliliter of whole blood. There have been other states that have adopted this level. We'll get to that in a second. One thing, though, that's really, really important to notice with this is that while your level goes up very quickly, it drops very quickly as well. And so within 2 hours of consuming, the level of Delta-9 THC in your blood may very well be below that 5 nanogram level. The level of subjective impairment and the level of the impacts on your behavior and your reaction time, things like that, they don't follow that same line down. They're much more gradual. Those effects are still in your system, they're still affecting your behavior for a much longer period of time. Other two things, when you look at concentrates, we have very, very limited information about what that looks like in that first 10 minutes. Preliminary information would indicate that while you might go up to 120 nanograms with a regular joint, you can go much, much higher with concentrates. And edibles have a completely different story behind them. It takes an hour to 2 hours for an edible to hit your system. And your level, the THC level in your system, may never go above 5 nanograms. You can be subjectively very, very high, but the Delta-9 level in your body will not indicate that. And when laws are predicated on an actual level in your system, then it becomes very, very difficult. And I'll get to issues around convictions after a while. But it's just really, really important to know that especially when you're looking at something like impaired driving, that getting your laws right and getting the training right for your law enforcement is really, really important. Because one thing we have done in Colorado is we've put resources into training. We use our marijuana money to train law enforcement to detect impairment at the roadside and to be able to testify to it in court. And that kind of, those behavioral markers are there regardless of the amount of THC in your blood. Okay, so now just a little bit of trend data. So the Colorado State Patrol started tracking information on whether marijuana was the impairing substance or one of the impairing substances in 2014. What we found is that between about 12 to 17% of the marijuana citations given out by our state patrol, they indicate that marijuana is either the primary impairing substance, or one of the impairing substances. Because really polydrug use is something that is very common in combination with alcohol or other drugs or all three. One thing though, the total number of DUIs given out by our state patrol has not increased over the last post-legalization. It went down and it's been maintained effectively flat over the last 3 years. The number of people being arrested who have marijuana, troopers believe that marijuana was the impairing substance, has not changed either. Okay, so we did begin asking in the adult use survey that Caitlin mentioned whether or not people report driving within 2 to 3 hours of using marijuana. What we found, of all adults, about 3% report driving within 2 hours of using marijuana, and about 20% report driving, 20% of users, report driving within 2 to 3 hours of using marijuana. Okay, so this is another fun one. Fatalities are different, and fatalities have a different, obviously they have much greater attention paid to them, and we do have some better data on what drivers are testing for in fatal accidents. So these are the number of fatalities where the driver tested positive for some cannabinoid. It may not have been Delta-9 THC, and we cannot definitively say they were impaired by cannabis at the time of the crash. These are definitely limits with this, and I've got a little bit more data that talks about, Delta-9 more specifically. What we have seen, though, is an increase in the number of drivers who are involved in fatalities where they did they used cannabis. So this is based on blood tests, so it's not based on urine testing, which the metabolites from urine testing can stay in your body for a really long time. Metabolites can also stay in blood for a very long time. Delta-9 THC, though, generally comes out of your blood. If you're a regular user, Delta-9 THC stays in your blood longer, but if you're a casual user, it comes out pretty quickly. The other important thing with this is that bottom line is people who only tested positive for some cannabinoid. So the polydrug use in drivers involved in fatalities is something that is concerning because impairment with cannabis and impairment with other substances, the recent research that I read indicated that it was at least additive. And so when you have some cannabis and some alcohol, you're more impaired than if you just had one or the other. We finally did start collecting some better information on Delta-9 levels in the body in 2016. This is all reported from coroners, and there's limits about what we can force coroners to report. So this is broken down by the level of THC in your system. So that far right bar is there was any Delta-9 detected. So this is specifically Delta-9 THC, the primary active metabolite in cannabis. We found about 22% of fatalities, the driver had Delta-9 THC in their system. However, it was only about 8% of fatalities where the driver had that Delta-9 THC at that 5 nanogram level or higher. I will tell you one thing, when it comes to establishing that level, the International Associations of Chiefs of Police recently came out with a recommendation that states who are adopting cannabis legalization, if they're going to, they actually recommend against establishing a level, which I thought was a very, very interesting recommendation to come from them. And that they really believe that focusing on training of law enforcement was going to be a better way to address the problems around impaired driving. So in 2016, we did start improving our data collection that was just looking at DUIs in general. My colleague, who's way better at this than I am, thank goodness, was able to get toxicology information from 4 different labs. So this could be blood testing, this could be breath testing, and she linked it with court filings for DUIs, which were there were about 27,000 court filings in 2016. She was able to link all these together. You can refuse a test in Colorado, and about a third of people refuse a chemical test when they get pulled over. And we were actually able to link about 2/3 of the cases. So that was really, really positive. There is, of course, no common key to actually link all these things together. Again, she was able to do that using some fuzzy matching. So what we found in toxicology was that when you looked at single drug, the vast majority of people who were getting DUIs, and we were able to, when we had their data, about 91% of them only had alcohol on board. There are some serious limits, though, to these data in Colorado and probably in most of your states as well, because when you have a per se level of 0.08 for alcohol, and you pull somebody over and they're at that level, there's really no need, at least, so in Colorado, there's no need to go beyond that. There's no additional penalty if you've got alcohol and drugs in your system if you're at that per se level. And to get evidence for that, to do a breath test is effectively free for alcohol. To do a blood test for alcohol on its own is about $30. If you're going to do a blood test for drugs in Colorado, it's about $300. And so when law enforcement is looking at the fiscal math, if they know that they've got you on alcohol, they're probably going to stop there. And so the fact that 91% of the single drug are alcohol is possibly indicative of the differences in testing. It could be that we have an underestimate of the number of people who have polydrug, most likely, because only 6% of the people who got DUIs had only THC in their system. When we do look at polydrug use, though, alcohol and THC are the most common combination, and we find this with the fatalities data as well, where about 37% of those with polydrug in their system had alcohol and THC. And when you add all the THC stuff together from these two slides, you find about 13% of drivers who were arrested for DUI, and we have their toxicology information, about 13% of them had THC either alone or in combination with some other drug. When you look at the state patrol data and you get between 12 and 17% who they see as, or they detect impairment from marijuana or marijuana in combination with other drugs. There's a local agency a couple local agencies also report their data to me, and it's not in here, but they get between 12 to 15% of drivers who who test positive for THC either alone or in combination with alcohol or some other drugs. So when these three things combined, it seems like when I look at the convergence of the data between 12 to 17% roughly, there's THC involved in DUIs. Oh, and the top 5 other drugs, stimulants, so meth and cocaine, and then benzodiazepines are the most common other kinds of drugs. I think that we were very surprised that opioids were not on this list, and they're not on this list in DUIs. They're also not on this list when it comes to fatalities. It really is stimulants and benzodiazepines that we see more often. So what happens when you've got a case and you only have THC as your evidence to try to get the conviction on a DUI? What we find is that in 80% of the cases, 81% of the cases, you get a guilty verdict if you've got that driver at that magical 5 nanogram limit. However, if they're below that limit, the conviction rate drops dramatically. If they've got Delta-9 THC on board, but it's below 5 nanograms, the conviction rate effectively drops in half to about 41%. Whether that is indicative of less impairment or whether it's indicative of it just being more difficult to get a conviction because of that 5 nanogram level isn't totally clear. Okay, so what are some of the youth impacts that we're seeing? Marijuana offenses in schools. So the left is elementary and secondary schools, and the right is colleges and universities. Initially, we saw 2 years of pretty steep increases in marijuana offenses reported in schools, and then we've seen now 3 years of decreases. Whether or not this is a function of less marijuana in schools or changing of administrative policies in reaction to marijuana in schools, I think that if you talk to law enforcement, if you talk to school resource officers, they will say that they're seeing more marijuana in schools. The data would indicate that it's either there's less marijuana in schools or the reaction to that is changing. It probably is the latter. Colleges and universities, though, we have seen an increase over the last, especially the last year. When we look at marijuana arrest rates by race, this was an interesting trend for me. Initially, the arrest rates for African American youth went up pretty substantially, and over the last 3 years, they have come down. The disparity has actually reduced a little bit between whites and Hispanics and the African American population. In this particular one, the Hispanic population actually has the lowest arrest rate, and whites are in the middle. So just a couple more things really quick. School discipline. This is school discipline for drugs. So these are suspensions, which is the green line, expulsions is blue. What we saw, interestingly, was an increase in the 2009-2010 school year where it went up dramatically. It was like basically 1,000 suspensions and expulsions. And since then, it's been relatively flat. Now keep in mind, this is just for drugs overall. They didn't actually start separating marijuana out as a reason for discipline until 2016-17. However, when they did that, what we found was that, so marijuana is on the top in each of these. It accounts for about 3% of suspensions. This is of all suspensions. It accounts for about a quarter of expulsions and not quite a quarter of law enforcement referrals. And so, whether or not it's, increasing or decreasing, marijuana is, when we look at it, when we look at all the different reasons you could be suspended or expelled, it's the single most common reason to be expelled or to get a law enforcement referral. And that's what I got.
So we'll open it up for your questions if you guys have any questions.
I have a question. There was a piece of data that you put up really early, and it was about increased use amongst older adolescent girls. And I was wondering, because I've seen sort of some data that indicates that alcohol use is also on the rise, and I wanted to know if you saw that correlation as well, and I wanted to get sort of your thoughts on if there is increased substance use amongst older adolescent girls, why is that demographic going up while other demographics are going down?
Okay. I can speak to Colorado, but Julia may want to jump in for the other states. We have not looked at alcohol, or I haven't personally looked at alcohol that way. This is the first time I've seen any substance use look that way for that particular survey. Kind of our working hypothesis in the office is that females tend to not take risk like males. So boys, whether marijuana was legal or not, were likely still using at the same prevalence before and after legalization, while females may have been more sensitive to that and did not want to participate in an illegal activity prior to legalization, but now that it is legal to them, it might be like a normalizing of the substance, and maybe that's why females' use is increasing. At least that's what we're hypothesizing in Colorado. And up to now, these increases are not significant. We're just tracking them and watching this because it is very different from all the other populations, but I just wanted to point that out. And then do you have any comments?
Yeah, I can speak to Oregon and Washington, and we have not seen, in fact, we've continued to see declines in alcohol use among young women of different age groups. And we've looked at it quite a lot in Washington because we had a substantial change in law in 2012 where the state used to be that you could only buy hard liquor in state-controlled liquor stores in Washington State, and starting in June of 2012, which was right before the legalization vote on cannabis in Washington State, that that was dismantled. So now you can buy hard liquor in all kinds of different stores. So we've spent a lot of time looking at youth alcohol trends, and we had wondered, kind of for the same reason, if young women would be more influenced by that change in law, but we haven't. They have continued to decline.
And I'll just add to that as well. We've looked in our adult surveys, and female use in 18 years and older is also starting to catch up with male past 30-day marijuana use. And then we also have some indicators on a survey that tracks use in pregnant women. And in 2016 was the first year that we saw in Colorado an increase in the estimate of pregnant women that are reporting use during pregnancy. And this is not significant yet, but this increase is quite alarming, since when you couple it with, we're seeing increases in these high school girls, and then we're also seeing increases in women of childbearing age reporting past 30-day marijuana use.
Hi, this question's for Katie. Mostly, you showed some slides on an increase that showed an increase in poison control calls and emergency room visits, and they looked like there was a significant increase. And I was wondering if you could provide some background on whether that's, is there any breakdown within that of people who maybe weren't reporting before it was legal, or tourists that are coming to Colorado, versus just a sheer kind of, I guess, net increase in usage, if you could kind of assess some of that out.
Okay. With the Poison Center data, that is coming from the National Poison Data System, and what we think is happening there is basically we had a stable trend before legalization, and then with legalization, I think there was a heightened awareness because we saw an increase in call volume and the rate of calls indicating marijuana exposures, but then in most states we're starting to see that level off. That's not the case, like I said, for children, but all other breakdowns that we've done of that data, it is leveling off over time, so that indicates to me that there was an increased awareness either through providers, because a lot of those calls are people going to a provider and then a provider calling the Poison Center for help on this particular intoxication. However, for hospital and ED data, we've done extensive research just talking to the coders that are actually coding marijuana codes into those discharges, and talking to providers. And to receive a code that indicates marijuana use, then marijuana has to be, there had to be a treatment in that discharge involving marijuana. So it's not that people are going in and saying, oh, I use marijuana regularly, like I smoke tobacco regularly, and receiving a code. There was something in the treatment that required that code to be there. That doesn't mean that marijuana was the cause for the visit. And I didn't indicate this when I was presenting, but we did have a shift in 2015 to a new coding system. So before 2015, we had 4 codes that indicated marijuana use, and 2 of them were about poisonings, but they also included psychodysliptics, which are basically LSD and mushrooms. Once we shifted into ICD-10, we now have 54 codes that indicate marijuana use, and there are some poisoning codes in there that indicate poisoning by cannabis, and what we're finding out now is that when someone has one of those codes, that visit is likely due to cannabis exposure. But it does make up a very small percentage of our overall calls. So I think in the future, we're going to be able to tease out a lot more, but at this point, we have about 1.25 years of data to look at that.
Thank you.
Yeah.
Any other questions? All right, well, thank you so much for joining us.